Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
1991, my father, who you know I adored, we just lost him a year and a half ago, we brought him to Dr. Lederman. You need to bring yourself or someone you know who needs to have the barnacles scraped off their backside to get their rear in gear and walk in there right now because Dr. Gil Lederman is New York's only triple board certified Harvard-trained radiation oncologist, first brought the non-invasive stereotactic body radiosurgery to America, and he's got the longest experience treating cancer using radiosurgery. So look, do yourself a favor. If it's cancer-related, and I'm talking breast, lung, pancreas, liver, kidney cancers, and more, you got to bring it to Dr. Gil Lederman. He'll send you an informative booklet DVD. You watch it first, you read, you sit down one-on-one with Doc Lederman, and then you prepare for what it is you want to do and you should be doing. Just call Dr. Gil Lederman at 212-CHOICES. Set up that appointment today, 212-CHOICES, or set it up for someone you know won't do it for themselves. At 212-CHOICES, that's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, M.D., New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman. We hope you're all fine and waking up to a good day with spring just around the corner. My name's Dr. Gil Lederman. I work at Radiosurgery New York. We're at 1384 Broadway, the corner of 38th Street and Broadway between Macy's and Times Square. We have a spacious cancer treatment center that's there for you. It's run for you. You're the boss. And as we'll see later in the hour, it's not the drug companies, it's you that we're focusing on. So that's the difference between a private center where the patient is the king or queen and other centers that are often run by the drug companies that provide elsewhere tens of millions of dollars. And obviously that's one reason people get chemotherapy in other centers. Maybe they'd like to know about other options. So we believe that you do have choices, and that's why our phone number is 212-CHOICES, 212-CHOICES. You can call us during the week. The best is to make an appointment. Someone called me yesterday and said, well, I have lymphoma. You don't talk about lymphoma. What would you do? Well, number one, we're a live program. If you want to talk about lymphoma or cranioblastoma or neuroblastoma or adenocarcinoma or lung cancer or breast cancer or prostate cancer or colon cancer, whatever you want to talk about, just call us at 1-800-848-9222. 1-800-848-9222. 1-800-848-9222. We're live. We're at the WABC studios in the heart of New York. We're only a few steps away from our own office, but we're here to answer your questions. We have goals. Our goal is to provide information to make you have a healthier life or to allow you the option of having a healthier life, to have better treatment and better outcome and avoid complications whenever possible. So we're here providing new information, and the information is usually from the week before. So it's information that you're not going to get from Huntley Brinkley or the usual news program. So it's very specific for people to get better health, better care, better outcome, especially those with cancer. We're a cancer treatment center, and that's what we do, treat cancer, see patients. If you have a worry about a nodule or a lump, give us a call. If you have cancer and you don't like what's going on, give us a call. If you have a suspicious lesion in the breast or the skin or elsewhere in a lymph node, come in. Someone asked me yesterday, well, I have lymphoma, how would you treat me? On the phone. Well, I tried to explain that treatment of cancer involves an evaluation of the patient, an understanding of the patient, and it's fairly complex. It's not like going to a car wash and ask if it's going to be done by hand or machine. Cancer treatment involves knowing about the pathology of the cancer, which is how the cancer looks under the microscope. And often we speak to the pathologists themselves to get a better idea of the pathology and the aggression of the pathology. It involves evaluation of the scans, whether it's PET scan, CAT scan, MRI, or other testing. And very commonly I'll get on the phone and speak directly to the radiologist. Very commonly I'll ask for different tests. Maybe the best test hasn't been done. Maybe someone just didn't want to call and get the approval for the best test. Now, you may say that's strange, but in fact, we see that very frequently, that the best test hasn't been done, or maybe it was done a year or two ago. Well, cancer's goal is not to sit still. Cancer's goal is to move, to grow. Cancer's goal is to hurt you. And our goal is to help you. So we have a conflict there. Cancer's out to hurt you. We want to help you. And to do that, you need to get the best testing and the best understanding of the disease. And when we do that, we give copies of the reports to the patient. So when you go away from us, you have copies of the pathology report and the PET scan report. You have it in your hands. Unfortunately, very commonly, we find many patients don't even know what kind of cancer do they have. Do they have Hodgkin's lymphoma or non-Hodgkin's lymphoma or B-cell lymphoma or T-cell lymphoma or null-cell lymphoma? What's the exact type of cancer? Is it adenocarcinoma or squamous carcinoma? Is it glioblastoma or astrocytoma? So maybe it doesn't seem necessary to a patient or family, but it's a little like a key and a lock. If you don't have the right key, you can't open the door. And usually when you're there fumbling with the keys, you want the right key for your lock. And if you don't have the right key for your lock, you're not going to open the door. And if you don't have the right answers for the patient, you're not going to get the results that you want. So for the patient who called and said, how do you treat lymphoma? There might be 1,000 different ways we treat lymphoma. We have to know about the patient and the function of the patient and the type of pathology and the extent of the cancer and the response to prior treatment and the physical exam, a current physical exam and blood tests. And we can do this, and we do this all very quickly, usually within an hour or 2 hours or a day. But every case is unique, and I think that's how you would want to be treated. You would want to be treated as a unique person with a unique situation and what's best for you. So that's why it's so critical when you have cancer or suspicion of cancer to come in, spend some time. Yes, it's an investment of time. And yes, it takes away time from your other activities. We understand that, and we apologize for that. But we're also spending a lot of time and effort on you, and you want those hours, you want that attention, and only when you get that time and that attention will you get the best possible results. So yeah, phone calls are great, and I'm happy to take your phone calls. We do it all the day, all the time. You can call us at our office, and you'll get an answer on the phone, but it's not a replacement for a consultation. A consultation is where we go through all the materials, take notes, order tests if necessary, and make recommendations after a complete history and complete physical exam. So yes, you can call us at 212 Choices, day or night. We have doctors on who answer your calls, not a machine. You don't talk to machines because we're a private cancer center that takes care of our patients. You get to speak directly to the board-certified doctor, not students, not interns, not trainees. You get answers and not confusion. As my father says, chance favors the prepared mind. Chance favors the prepared mind. Well, to be prepared means you have to have the facts. And without the facts, whoa, get the facts. So we do have booklets and DVDs, and we're happy to send them to you. You can call us at 212-CHOICES, 212-CHOICES. You can call for an appointment. We're not only super convenient. We are super convenient, but we're not only super convenient. I think we're really super to take all this care and attention to each patient. We're super convenient because we're located in the middle of Manhattan. We're close to buses, trains, subways, Grand Central, Penn Station, PATH trains, Port Authority. We're right in the epicenter, the heart of Manhattan, and we're happy to see you. We even have something called the Urgent Cancer Consultants where we will see you, we promise, within one business day, just by calling us at 212-CHOICES, 212-246-4237, 212-246-4237. So give yourself the most chances, give yourself the most choices by calling us at 212-CHOICES. And again, we accept most insurances, Medicare, Medicaid. Our goal is to provide information for a healthier life, better treatment, better outcome. When you're newly diagnosed or if you're going through treatment elsewhere and you're just not getting better, the pain's not going away, the cancer's not going away, or you're not tolerating the treatment. Many patients come to us because they're not getting better and the treatment is not tolerable. So there probably are other options, and that's why we encourage you to make a call. Call us at 212-CHOICES. So we've been talking the last few weeks about this woman who's 100 years old. She was 100 years old. She was diagnosed with bladder cancer when she was 95. She thought, what the heck, I'm 95. What do I need to be bothered with treatment? I'm already 95. Well, guess what? Like I tell many people, you're more likely to make it to 100 than I am, and she made it to 100. And when she was 100, she is 100, she started bleeding and bleeding and bleeding, and she lost half of her blood through the urine from this bladder cancer. She came in to see us just a few weeks ago, and her blood count was down by 50%. She was bleeding profusely. Her daughter thought she was going to die. And we came for consultation, we examined her, got the history, got the pathology, gave copies to the family and the patient, got her staged up, and guess what? Even though it's been 5 years, the cancer was still only in the bladder. Wow. Only in the bladder. Talked to her about all the treatment options. She decided she only wanted stereotactic body radiosurgery. Now, stereotactic body radiosurgery is non-invasive treatment. It allows us to hit the cancer without, in general, hurting other tissues. And usually there's only 5 treatments. So unlike elsewhere where you can get weeks and weeks, months and months of treatment, she chose just to have radiosurgery, no chemo, no prolonged treatment, 5 treatments. And I reported to you last week after 2 treatments how the bleeding had nearly stopped. Well, this week she had her 5th treatment, and the bleeding has stopped. So 5 treatments, her bleeding has stopped. She'll come back, she'll get restaged. We'll hopefully give her proof that the cancer is going into remission. She is happy. She's achieved her main goal, which is to stop the bleeding. The bleeding was going to take away her life. If you don't have blood cells in your body, you can't live. So her bleeding has stopped, which means that the cancer that was eating through the blood vessels has been stopped by just 5 treatments, focused beam radiosurgery, which we pioneered. We have the most experience. Each treatment was 15 minutes. She came in, got a treatment, went home. I believe she's happy, I believe her family's happy, and even the doctor's happy. So it's fantastic news. This case, bladder cancer, but we have thousands of cases. We've actually treated about 20,000 patients. We were the first in America with body radiosurgery, which is non-invasive treatment, And many people choose it over prolonged standard treatment or chemo or surgery. So it's worth a thought. It's worth coming in and spending an hour and learning about your choices.